Away from that, water, health and environmental stakeholders have called for a united approach in tackling issues relating to water, sanitation and hygiene in the country. And this was during the inauguration of a Sanitation and Hygiene Technical Subcommittee of Nigeria's National Wash Policy Development Committee, which will help in the formation of a central policy to tackle wash issues. Amadine Uyi reports.
According to the World Health Organization, safe drinking water, sanitation and hygiene are crucial to human health and well-being. WHO says that they play a key role in preventing numerous neglected tropical diseases and preventing needless deaths of children. While much effort has been put in place to ensure provision of safe drinking water, however, the case has not been the same for sanitation and hygiene.
These days, we have realized that there's a need to pay additional attention on sanitation and hygiene so we can bring them at the same level as important as water supply.
As stakeholders from Nigeria's Ministries of Health, Environment and Water Resources, including development partners from the Water Aid Nigeria, converge on the nation's capital Abuja to inaugurate the Sanitation and Hygiene Technical Subcommittee of the National Wash Policy Development Committee. They say the importance of wash as a key national objective cannot be overemphasized.
Sanitation and hygiene is very important. You know, when you look at it, you talk about wash, but you say sanitation and hygiene. This is preventive health. It's preventive health. When you have adequate sanitation and proper hygiene practices, then the visitation to hospitals will be reduced, our workforce will be healthy to work, and then it will tell on the economic developments of the nation.
If you look at WASH, is water, sanitation and hygiene. And if you talk of water, Ministry of Water Resources, you know, they have a major role to play in that angle. You talk of sanitation, that's the core work of Ministry of Environment, and you talk of hygiene, which is the Ministry of Health. So the WASH, that is why the three ministries are coming together to have a comprehensive WASH policy. That every ministry's role will be clearly defined.
If people have no water to drink, to wash their hands and to keep themselves clean, disease burdens will increase, people will fall out of school, children will fall sick. The economic burden of curative medicine rather than preventive will draw resources into things that could have been prevented, that could be invested in other things, and that slows down economic. I mean, if you are treating diseases you can prevent, which is usually more expensive, then you have less money to build schools for roads and other things.
They say the subcommittee will help in producing a national plan that will spearhead water, sanitation and hygiene development objectives in the country under a central policy umbrella.
In the past, we have had pockets of policies, you know, not aggregating the entire wash. We have had sectoral policies in water supply, small policies in sanitation, policies in hygiene. Now, the idea of this committee is to develop one very well thought out document, policy document that will aggregate all the shades of wash so we can have everything under one umbrella.
Stakeholders believe that with the subcommittee now set up, Nigeria can effectively implement a national action plan aimed at addressing challenges arising from an uncoordinated approach to issues related to water, sanitation and hygiene. Amadine Uyi, reporting for News Central.